Okay, good morning to everyone. Today is the third day or fourth day of my Ramadan. Today, Ramadan? Sixth? Already 6 days past. Time is going so faster. So don't delay to study. Time is so faster that after some days you will find out that you are appearing in final Prof. Right? So don't lose your time anyway. So actually labor means labor. That is some works. There is some works there. What works there? You see in the model, that is the uterus, the fetus, and also of the cervix is here. Here cervix. It is closed or open? Closed. Presentation. This is occiput. You know the definition of the presentation? Definition is the part of the fetus which lies in the lower part of the uterus. So this is, but I am seeing here that is occiput. But vertex vertex is the area, arbitrary area. Anteriorly is what is bregma, then coronal suture, posteriorly occipital protuberance, and then parietal eminence. This area is vertex. This area is brow, and all this area is face. So this is vertex. This is vertex. Okay, vertex is the denominator is occiput. In vertex, every presentation there is a denominator. By denominator is the area, the presence of which denotes the position. So occiput is, suppose here, occiput anterior, sometimes occiput lie posterior. So this is denominator. Occiput is the denominator of the vertex presentation. And that is so vertex. This area is the vertex. This area is brow and this is face. So vertex, what is the commonest presentation is the vertex. Okay. Anyway, today I will labor. So some changes in the uterus, some changes in the fetus, some changes in the placenta, and some changes in the cervix. So what are the, actually there is three power. For any work need power, energy. So energy related with the uterine contraction, energy related with the movement of the fetus, and another in what energy? Passage. So power 3P. 3P is, one is contraction, uterine contraction. Another P is passenger who come to the world. The fetus will come to the world. That is actually delivery. Delivery not related, same not as labor. Delivery means coming of the fetus to the outer world. That is expulsion of the fetus to the exterior. That is delivery. So this is power, uterus power, passenger, fetus, and another power what? Passage. This passage. She will overcome these spaces. That is cervix. Cervix need to open, vagina need to open, perineum need to relax. This is the passage. Pelvic axis. That is called pelvic axis. Vaginal axis also. So 3P is uterine contraction, then another the fetus, another is passage. Power, passage, passenger. Okay, now you know the how labor starts. So the some changes, both anatomical, physiological changes, and you think that when labor starts, there is the some criteria of normal labor. Everything in our obstetrics, there is normal condition, another is abnormal condition. So you should know which is normal at first, so that you can understand which is abnormal. So normal labor, there is some criteria. What is the criteria? You should know. Criteria, that is full term. Sometimes baby delivered at 30 weeks, sometimes 32 weeks, 37 weeks. So all are preterm. So you should know what is term, what is full term, and what is preterm. Preterm is normal or abnormal? Normal. Abnormal. So criteria is baby, the fetus. When we call baby? After delivery we call the fetus as baby. When until within the mother's womb it is fetus. So the fetus must be term or full term pregnancy. Term is 39 weeks. 39 to 40 weeks or 42 you can say sometime. 42 weeks. 39 to 42 is term. Full term is 40 weeks. 40 weeks. And post-dated means after EDD. After expected. Okay, listen to me. Later we will discuss. After expected date of delivery, every day is day. First day, second day, third day, like this. Okay. So in our condition, post-dated is we can allow up to 1 week. 41 weeks. That is 41 weeks. If no spontaneous onset of labor, we start induction usually within 40 to 41 weeks. That is another chapter. Anyway, so there is uterine contraction. You should know the nature of the uterine contraction, descent of the fetus, and movement of the fetus. Then movement, and then the fetus will come out. Now you know what should you know? The nature of the uterine contraction. You know that is during pregnancy. During pregnancy, what changes? Uterus become hypertrophy, hyperplasia. There is Braxton's contraction, relaxation, and uterus enlarge. So there is some rhythm in during pregnancy. Sometimes some patient tell there is abdominal pain. There is asymmetrical. There is sometimes not continuous pain, sudden uterine contraction followed by pain. It is normal or abnormal? This is normal. Sometimes there is uterine contraction, that is called Braxton's contraction. You know, every smooth muscle, uterus is smooth muscle, like skeletal muscle. Smooth muscle. So smooth muscle is viscera. Viscera, there is contraction and relaxation. That is one of the quality property of the smooth muscle. So there is contraction, so all contraction followed by there is pain. And contraction, every time, if there is contraction, it should follow relaxation. Okay? So contraction, pain, and pain goes on with the period of relaxation. Now you should know that there is so many visceral pain during pregnancy. What are the other viscera? Bladder, kidney, ureter, then colon, then these are mainly rectum, sigmoid colon. So if pregnancy means there is a period of time, the physiological and changes like this, but it cannot be associated with other disease. Yes, their pregnancy may be associated with appendicitis, may be associated with cholecystitis, urinary stone, or cholelithiasis. It may happen or not. Yes, their pregnancy may be associated with other medical disorders, other infection, other diseases. So, any pain, we should consider everything. How we should consider? We should see the previous documents from history, from examination. She may have some records. She may have cardiac disease. She may have diabetes mellitus, renal disease, and so on. SLE, like this. So we should think always everything, which is maybe pregnancy may be associated with abnormal condition also. Anyway, So pain, we should discuss today with the labor pain. So labor pain, there is uterine contraction start. Now you go through the books how the uterine contraction starts. Is the first trimester, second trimester, third trimester. There is a long period. In this long period, long passage, long time, no pain, no contractions, how labor pain starts. So you should think that must be there some changes in the fetus, some changes in the placenta and some changes in the uterus. Most is changes in the placenta. You know the placenta secreted so many hormones. Yes, oxytocin secreted just before labor pain. And there is alteration of the estrogen and progesterone. You know the pregnancy is a period of relaxation. So relaxation is associated with progesterone hormone mostly. So there is progesterone কমা লাগবে না বাড়া লাগবে যদি কন্ট্রাকশন স্টার্ট করে তাহলে progesterone কমতে হবে very good. So there is alteration in the ratio of the progesterone and estrogen. And there is a local secretion of the prostaglandin. From where prostaglandin is secreted? Prostaglandin secreted from the amniotic membrane, mostly from the amniotic membrane, cervix, local secretion of the prostaglandin. So, and fetal hormone, there is so many, in the fetal-maternal circulation, there is also some changes. All these causes, and most important is, the uterine stretching. Stretching, how it's stretching? When it enlarged, and there is some limitation of the uterus. Uterine wall will be thicker or thinner? Thinner, gradually. So there is and the বাচ্চাও বড় হচ্ছে, amniotic fluid আছে. So there is a stretching in the uterine wall. Stretching is the important mechanical factors to start the labor pain. Okay, now labor pain starts. From which region starts? You see some told the back region, some told in the fundus. So at first there is focal point, some pain starts. Then as a whole the pain become diffuse. So contraction starts in the fundal region followed by relaxation in the cervix, lower uterine segment. Okay, cervix. So contraction starts upper uterine segment, relaxation start in the lower uterine segment. Okay, so there is a short nodes of the lower uterine segment. You have and isthmus, the region of the isthmus from the lower uterine segment. So this is and how the opening cervix become. You think? Can you imagine? The cervix become close here. Close. It should be open. You see the cervix, how it is about 3 centimeter open. This is full dilated. This is full dilated cervix, and this is the what is bulging. This is bulging of the fetal head. This is called crowning. This is called crowning. And so the changes in the cervix. What you you heard the name Bishop score. So we assess the condition of the cervix, and also we think the labor would be satisfactory or unsatisfactory. We can assess by the Bishop score whether it needs ripening or not, or need that is contraction, induction need or not. So that is Bishop score. There is a short notes also Bishop score. Okay, so you think now that Bishop score, the Bishop score cervix. Suppose here cervix. So cervix, what are the thing of the cervix? How cervix? Normally, what shape of the cervix, what length of the cervix, what structure of the cervix. Medical science is very interesting if you get interest. You know Allah how creates us. It is a miracle, the miracle of our life. and we do not know how many days needed for the Allah to make us. But it is not in one day. I know one hadith I know that male for female Allah needs more times. Would you know this? Why? She makes female lovely and she needs concept, pregnancy, so many different. So Allah creates female takes more times. So you should imagine a mother, a girl, a woman, what their function, and male what they do. Anyway, so this so normal length is 3 centimeter. It is cylindrical shape. It is closed cervix. So it will. Can you imagine? It will be paper thin, and will be enlarged 10 centimeter. Understand? It will be enlarged 10 centimeter. It will enlarge 10 centimeter. Full dilatation is called 10 centimeter. When cervix is full dilated, you cannot feel like this. Cervix cannot be filled. This we cannot feel. It goes up. The lower uterine segment must with the upper uterine segment. You cannot feel the cervix when cervix is fully dilated and taken up. There is a short note of the effacement. Effacement is changes of the cervix. Cervix become closed like this, and it become thinner and goes up. The process by which the cervix changes thinner and it becomes full dilated, that is called effacement. So that is also ripening. Ripening means cervix is ready to go open and then the fetus will come out and then will deliver. Okay. So this is called ripening of the cervix. Okay. Now sometimes there is a term induction of labor. Sometimes if there is no ripening, we do ripening of the cervix by how? By prostaglandin. Misoprostol. You heard the name prostaglandin E1. That is called misoprostol. So sometimes we need it for if we see that she needs delivery by vaginal delivery, but no ripening of the cervix, but everything is okay. So we need ripening of the cervix, and also that is called induction of the labor. Okay.